Okay. Teeth and Vitamins. Pounds and Inches by Dr. Simeons. Patients whose teeth are in poor repair sometimes get more trouble under prolonged treatment, just as may occur in pregnancy. In such cases, we do allow calcium and vitamin D, though not in an oily solution. The only other vitamin we permit is vitamin C, which we use in large doses combined with an antihistamine at the onset of a common cold. There is no objection to the use of an antibiotic if this is required, for instance by the dentist. In cases of bronchial asthma and hay fever, we have occasionally resorted to cortisone during treatment and find that triamcinolone is the least likely to interfere with the loss of weight, but many asthmatics improve with HCG alone. Alcohol. Obese heavy drinkers, even those bordering on alcoholism, often do surprisingly well under HCG, and it is exceptional for them to take a drink while under treatment. When they do, they find that a relatively small quantity of alcohol produces intoxication. Such patients say that they do not feel the need to drink. This may in part be due to the euphoria which the treatment produces, and in part to the complete absence of the need for quick sustenance from which most obese patients suffer. That's good to know. Though we have had a few cases that have continued abstinence long after treatment, others relapse as soon as they are back on a normal diet. We have a few regular customers who, having once been reduced to their normal weight, start to drink again, though watching their weight. Then, after some months, they purposely overeat in order to gain sufficient weight for another course of HCG, which temporarily gets them out of their drinking routine. We do not particularly welcome such cases, but we see no reason for refusing their request. Tuberculosis. It is interesting that the obese patient suffering from inactive pulmonary tuberculosis can be safely treated. We have, under very careful control, treated patients as early as 3 months after they were pronounced inactive and have never seen a relapse occur during or shortly after treatment. In fact, we only have one case on our records in which active tuberculosis developed in a young man about 1 year after a treatment which had lasted 3 weeks. Earlier x-rays showed a calcified spot from a childhood infection which had not produced clinical symptoms. There was a family history of tuberculosis, and his illness started under adverse conditions which certainly had nothing to do with the treatment. Residual calcifications from an early infection are exceedingly common, and we never consider them a contradiction to treatment. The painful heel. In obese patients who have been trying desperately to keep their weight down by severe dieting, a curious symptom sometimes occurs. They complain of an unbearable pain in their heels, which they feel only while standing or walking. As soon as they take the weight off their heels, the pain ceases. These cases are the bane of the rheumatologists and orthopedic surgeons who have treated them before they come to us. All the usual investigations are entirely negative, and there is not the slightest response to anti-rheumatic medication or physiotherapy. The pain may be so severe that the patients are obliged to give up their occupation, and they are not infrequently labeled as a case of hysteria. When their heels are carefully examined, one finds that the sole is softer than normal, and that the heel bone, the calcaneus, can be distinctly felt, which is not the case in a normal foot. We interpret the condition as a lack of the hard fatty pad on which the calcaneus rests, and which protects both the bone and the skin of the sole from pressure. This fat is like a springy cushion which carries the weight of the body. Standing on a heel in which this fat is missing or reduced must obviously be very painful. In their efforts to keep their weight down, these patients have consumed this normal structural fat. Those patients who have a normal or subnormal weight while showing the typically obese fat deposits are made to eat to capacity, often much against their will, for 1 week. They gain weight rapidly, but there is no improvement in the painful heels. They are then started on the routine HCG treatment. Overweight patients are treated immediately. In both cases, the pain completely disappears in 10 to 20 days of dieting, usually around the 15th day of treatment, and so far no case has had a relapse. We have been able to follow up such patients for years. We are particularly interested in these cases as they furnish further proof of the contention that HCG plus 500 calories not only removes abnormal fat, but actually permits normal fat to be replaced in spite of the deficient food intake. It is certainly not so that the mere loss of weight reduces the pain, because it frequently disappears before the weight the patient had prior to the period of forced feeding is reached. The skeptical patient. Any doctor who starts using the HCG method for the first time will have considerable difficulty, particularly if he himself is not fully convinced, in making patients believe that they will not feel hungry on 500 calories and that their face will not collapse. New patients always anticipate the phenomena they know so well from previous treatments and diets, and are incredulous when told that these will not occur. We overcome all this by letting new patients spend a little time in the waiting room with older hands who can always be relied upon to allay these fears with evangelistic zeal, often demonstrating the finer points on their own body. A waiting room filled with obese patients who congregate daily is a sort of group therapy. They compare notes and pop back into the waiting room after the consultation to announce the score of the last 24 hours to an enthralled audience. Kind of like the internet is now. Well, that's cool. They cross-check on their diets and sometimes confess sins, which they try to hide from us, usually with the result that the patient in whom they have confided palpitatingly tattles the whole disgraceful story to us with a, "But don't let her know I told you." That's funny. Concluding a course. When the 3 days of dieting after the last injection are over, the patients are told that they may now eat anything they please except sugar and starch, provided they faithfully observe one simple rule. This rule is that they must have their own portable bathroom scale always at hand, particularly while traveling. They must without fail weigh themselves every morning as they get out of bed, having first emptied their bladder. If they are in the habit of having breakfast in bed, they must weigh before breakfast. It takes about 3 weeks before the weight reached at the end of the treatment becomes stable. For example, does not show violent fluctuations after an occasional excess. During this period, patients must realize that the so-called carbohydrates that are sugar, rice, bread, potatoes, pastries, etc., are by far the most dangerous. If no carbohydrates whatsoever are eaten, fats can be indulged in somewhat more liberally, and even small quantities of alcohol, such as a glass of wine with meals, does no harm, but as soon as fats and starch are combined, things are very liable to get out of hand. This has to be observed very carefully during the first 3 weeks after the treatment is ended, otherwise disappointments are almost surely to occur. Skipping a meal. As long as their weight stays within 2 pounds of the weight reached on the day of the last injection, patients should take no notice of any increase, but the moment the scale goes beyond 2 pounds, even if this is only a few ounces, they must on that same day entirely skip breakfast and lunch, but take plenty to drink. In the evening, they must eat a huge steak, with only an apple or a raw tomato. Of course, this rule applies only to the morning weight. Ex-obese patients should never check their weight during the day, as there may be wide fluctuations, and these are merely alarming and confusing. It is of utmost importance that the meal is skipped on the same day as the scale registers an increase of more than 2 pounds, and that missing the meals is not postponed until the following day. If a meal is skipped on the day in which a gain is registered in the morning, this brings about an immediate drop of often over a pound. But if the skipping of the meal, and skipping means literally skipping, not just having a light meal, is postponed, the phenomenon does not occur, and several days of strict dieting may be necessary to correct the situation. Very important. Most patients hardly ever need to skip a meal. If they have eaten a heavy lunch, they feel no desire to eat their dinner, and in this case, no increase takes place. If they keep their weight at the point reached at the end of the treatment, even a heavy dinner does not bring about an increase of 2 pounds on the next morning and does not therefore call for any special measures. Most patients are surprised how small their appetite has become and yet how much they can eat without gaining weight. They no longer suffer from an abnormal appetite and feel satisfied with much less food than before. In fact, they are usually disappointed that they cannot manage their first normal meal, which they have been planning for weeks. Losing more weight. Well, let's see. Okay, I think I'm going to put this in one more video. Okay. Losing more weight. Okay. See you in a bit. Bye.